Okay.
Great. Okay. Just to begin, if I could get you to say your first and your last name for me.
Yes, it's Stephanie, Stephanie. Last name Smith, Smith.
And your title.
I'm an infectious disease physician at the University of Alberta and the Director of Infection Prevention and Control at the University of Alberta Hospital.
Okay. The news, I guess, yesterday was we heard that there hasn't been a single case of influenza in Alberta. I know that there's a few reasons for that. We're kind of just doing a more expanded story. Can you tell me a little bit about, I guess, the reasons why we haven't seen any flu cases in Alberta this season?
Sure. So I think there's a couple of reasons. I mean, we certainly had indication that we might have a very mild influenza season based on the numbers from Australia, where they had, basically a non-existent flu season, and their flu season tends to be 6 months before ours because of the reversal of seasons. So, and I think that, certainly the measures, the public health measures that have been put in place for COVID have gone a long way in preventing transmission of influenza in Alberta and in the Northern Hemisphere generally. So I think you combine the public health measures with the fact that we also have a proportion of the population vaccinated. Those two factors really together have resulted in essentially zero transmission.
Wow. Lots of people compare COVID to the flu.
Yes.
It's obviously not a good comparison, but speaking from an infectious disease, expert, can you tell me why those two shouldn't be compared to one another?
Yeah, I mean, I think that we've traditionally kind of think of respiratory viral infections as all one big category. But I think more and more, and I think COVID has highlighted this, is that there are significant differences between individual respiratory viruses. And certainly this pandemic has highlighted one of the main differences between influenza and coronaviruses, and that is with respect to the way it's transmitted. So although they're both transmitted through large droplets, coughing, sneezing, etc., it's very clear that coronaviruses can be transmitted even before a person it has symptoms. So, with SARS-CoV-2, we have seen that people can transmit virus in the kind of 24 hours before they even have symptoms. And that makes it incredibly difficult to prevent transmission because people don't even realize that they're ill, which has led to obviously all the measures that we have in place right now. Compare that to influenza, where we think that the vast majority of transmission occurs after someone develops symptoms. And so it certainly is much easier to prevent transmission if you're only going to be infectious when you actually have symptoms. And, currently, certainly the recommendations are that if you have any respiratory symptoms, you should be staying home, which I think people are generally doing. And that's resulted in really, as I said, no transmission of influenza this season.
Will the flu come back? Like, is it possible for the flu to come back at all? Like, could we see cases of the flu? Is that possible?
Yes, I mean, I think that to say we have had a couple of cases of influenza in the province quite early in last year, basically. So kind of in I think October, November. But there really wasn't any transmission, which is great. But I think that we can expect that if the pandemic settles down and we go back to not having as many public health restrictions, that we could see more transmission of influenza. I mean, it does tend to have a seasonal variability. And so, I think that the reality is that we probably will have many of these restrictions in place, at least for the next little while. And so, by the time restrictions are eased, then influenza season may well be kind of over. And so then we're looking at really next year and what will the influenza season look like next year.
I know Hinshaw mentioned, the flu, and she mentioned COVID, and she gave some like great numbers because, a lot of people make those comparison. And one of the numbers was that, COVID has killed more people in the last 11 months than the last 10 years combined of the flu.
Certainly we do see a significantly increased mortality risk with COVID compared to influenza. From the very beginning, there have been comparisons between influenza and COVID-19, but, as I said, these are both respiratory viruses, so it's understandable that people want to compare them, but they are quite different in terms of the mortality, in terms of risk factors for disease. So certainly we see a significantly increased mortality in the elderly. And with influenza, we see that increase as well, but not nearly to the extent that we do with COVID. So I think that while it's interesting to compare them, I do think that we have to realize that COVID is or SARS-CoV-2 is a different disease, and that we need to take different measures. And I think one of the other things that is really important to realize is that, we've had vaccine for influenza. So when we have someone that has influenza introduced into the population, there are a percentage of people that will be immune. Whereas with SARS-CoV-2, then you're introducing a new virus into a population that has zero immunity. And obviously, everyone's working very hard on changing that, and people are being vaccinated. But for now, it's a very, very small percentage of the population that has been vaccinated. So we still are in a situation where we have the majority of Canadians being susceptible.
Why do you think more people got the flu shot this year?
Well, I think certainly there's heightened awareness of viral respiratory infections and how they can affect people in terms of hospitalizations and deaths and that kind of thing. And I think that at least the messaging that I heard from patients and colleagues is that they feel that, they're concerned about COVID and they're anxious about COVID. And yet there's not much that they can do while waiting for the vaccine. And so they want to be able to try to protect themselves as best they can from any other respiratory viruses.
Perfect. Those are all my questions. Oh, one more thing. I know, like you said, some of the measures have, helped in, some of the COVID measures have impacted the spread or not the spread of the flu. Does that include when people are traveling and stuff and maybe picking up a variant of the flu and bringing it back?
Absolutely. I think that, the fact that there's been much less international travel certainly results in fewer people, importing influenza into the country. So I think travel or lack of travel certainly has contributed to the decrease in influenza cases.
Very interesting. Anything else to add that you think is important to this story that you would like to include?
I don't think so. I think it's, it certainly is maybe a silver lining, if you can call it that we aren't seeing influenza. I think there was a lot of concern that are we going to have this double whammy of COVID and influenza? And luckily we haven't seen that.
Great. Thank you so much for taking the time and chatting with me today.
Thank you.
Thanks. Have a great weekend.
You too.
Bye.
Bye-bye.